inflammation. We tend to demonize inflammation in the body and do everything we can to switch it off. But inflammation is useful. It is an indication that your body is healing itself. Therefore, we don't want to get rid of it. We want to listen to it, answer the question that it's posing, and deal with that. Okay, the inflammation is the response to something else that's happening underneath. Don't just deal with the inflammation, deal with the underlying cause. As you'll see through all these videos, I'm always about get to the root cause. Don't treat the what, treat the why. Inflammation is information, my mantra. It's telling you about some process that is happening in the body that needs attention. Simply switching it off is not answering the question. When we get inflammation anywhere in the body, we need to go and find out why is that inflammation being produced. And as we're going to see in this video, that could come from places you might not expect. And then we need to deal with why the inflammation is being produced so that the body doesn't need to produce it anymore. But sometimes we need it. We need it there because inflammation is bringing the healing ingredients to an area. Let's look in a little more detail about what is inflammation. Okay, if you think of your body as this self-contained unit and it's kind of repairing itself and fixing itself, but sometimes our boundaries between us and the outside world can be breached. If you think of your skin, it's like the barrier between the outer world and your inner world, and it's therefore a part of what we call our immune system, the body's defense system. If your skin that's protecting you from outside invaders is breached, that could be a thorn, a cut, something that where you've opened up that skin, you've now got an open wound, you've basically breached the defenses and therefore are vulnerable to things getting in that shouldn't be there. Inflammation is going to occur where we get that open wound. The blood is going to bring ingredients to the area to help attack any what we call invading pathogens, any germs, bacteria that might have got in via that wound, and also to start bringing ingredients to start healing up that wound. When that breach occurs, we've got some local inflammatory chemicals, molecules that live in that local area that'll deal with the first line of defences, but then the blood's going to bring in more, and we actually have chemicals that are released that open up the blood vessel walls so that it can dump more fluid into the area. Think about what happens when you get a cut, right? It gets red, it gets hot, it gets sore. These are all signs of inflammation, and on the skin they're quite visible. But the same thing is going to happen when you get a little tear in your muscle. Say you've done a big whacking great kick and you went, whoa, something happened to my hamstring there. Go and watch the muscle injuries video to learn more about that. But essentially the same thing happens. You can get a little breach in the muscle's defences and you'll get an inflammatory response to heal it up. It is necessary. It is a necessary part of the healing process. So we don't want to stop it. We want to be able to manage it, not let it become a runaway train, but not completely either ignore it or squash it with anti-inflammatory either medications or strategies that we might be using. You need to use your discernment and deal with inflammation intelligently, not just do a blanket, that's a bad thing and I need to get rid of it. Let's have a look now at that injury process in the context of a muscle, a tendon, a ligament. Go and watch the Meet Your Soft Tissues video if you want to know more about the differences between these structures. But essentially, whenever we injure any of these types of tissue, we're getting some sort of tear. Now, that sounds like a really dramatic word, but it could just be like microscopic. If you think of a muscle, for instance, in the picture here, The fibres of that muscle are like strands of hair, but they're really teeny tiny, and they're running in a particular line of direction. So say in your thigh muscle there, typically most of the fibres are running straight up and down the leg. If we put a force through those muscles or that muscle tissue that goes across the line of those fibres, they can get torn. Might be microscopic, might be bigger. If you've just got those little niggles after class, little sore patches in the muscles, those are little micro tears in the muscle. Just like if you've cut your skin, you're going to bleed. Body doesn't like leaks in the system, it wants to plug the leak. So another job of the inflammation is to bring ingredients to help bind up that leak. Just like on your skin, you're going to get a scab formation if you've got a breach in the tissue. Same thing is happening in a muscle. But in a muscle, we call it an adhesion. An adhesive, think of that as sticky, right? So inflammation is bringing this sort of sticky matrix to bind up the area and plug the leak. But just like a scab on your skin, it's not the same as the skin around it. It doesn't stretch and bend. It's quite hard and brittle. And that is the same thing again that's happening in the muscle itself. Often we'll refer to that as a knot in the muscle. When I get dancers come to me and say, I've got a knot in my muscle, I'm always like, Muscles don't knot themselves, they don't tie themselves in knots. What you're feeling is one of these adhesions. It's an area where there's been a tearing of fibres and the body is trying to fix it. And what you're feeling, because often you'll feel either a tender spot or you can actually feel a sort of bump. You feel that it doesn't have the same consistency, the same texture as the tissue around it. Typically it's because it's an internal scab, essentially. If it's just a mild one, just doing regular movement and good stretching of the muscle, go and watch the Safe Flexibility series to learn how to safely stretch your muscles. But that'll help pull those fibres out of that kind of sticky scab-like formation back into their natural alignment so that you get good healing. However, even with a mild injury, but particularly with any sort of moderate to severe muscle injury, you really need some hands-on work. When you go and get soft tissue manipulation, massage, osteopathic treatment from a physical therapist, they're using their hands and fingers to actually break down those kind of sticky spots that have bound themselves up in the muscle and realigning the fibres back into their original orientation so that you get full recovery and elasticity back in that tissue. If you've had a severe-ish tear in the muscle and you don't rehab it, then that scab can start to become ingrained and it will actually become something called scar tissue. Go and watch the muscle injury video and I'll go into more detail with that. But you need to address it. And the inflammation, the soreness you feel in the muscle is just telling you that you've got some repair work going on. So you need to support the body in doing that repair work. To ice or not to ice? That is the question. People often don't know whether they should be icing or shouldn't, and it's kind of, there are lots of different opinions on this, even in the sort of the medical literature around icing. But here are some sort of rough rules of thumb that you can use to assess whether it's the right thing to do or not the right thing to do. Acute injuries. Now, acute typically refers to the first 24 to 48 hours of an injury occurring. Say if you've twisted your ankle and you know the first couple of days are normally it's swollen, it's hot, it's sore, it's uncomfortable. So we would call that the acute phase. We can use ice in this acute window, and particularly immediately after that injury is when it's most useful. It's going to reduce the swelling and the pain. So the ice essentially is going to slow down that dump of fluids into the area. Remember I mentioned that the blood vessel walls become more leaky so that more blood can be brought to the area, more healing ingredients can be brought to the area. When we ice it, anything that's cold, you know what happens when you get cold? You contract up. The blood vessel walls are going to contract up with the chill from the ice and stop all that fluid being dumped into the area. So all we're really doing is trying to turn the volume down on that inflammatory response, but we don't want to switch it off altogether because it's healing, okay? The ice can also help to modulate some of the pain receptors in the area. So in the nervous system, we've got nerve endings in our all over our body, and they can be going pain, pain, pain when we've had that injury, because they're trying to tell you, deal with this, there's an issue. Okay, you know there's an issue, you're dealing with it, and you want to bring that pain down a bit so you can bring your heart rate down and allow yourself to get more into healing mode. Go and watch the anxiety and stress videos to see why we need to be in a calmer state for the healing to happen. It can help do that. It helps calm down those angry receptors in the area and stop them from shouting quite so loudly. Now, how long should you ice for? Really, for any area of the body, a maximum of 20 minutes. But if you're icing a bony area, particularly an ankle, a knee, you really only want to be icing it about 10 minutes. There's not a lot of flesh there to absorb the chilling effect, and you're kind of straight onto the bones. So really I would only do 10 minutes for those sorts of bony joint areas. The reason we don't want to ice longer than that, because some people are like putting the ice pack on and then as soon as that one's kind of melted they slap another one straight on. You don't want to be doing that. You're going to end up getting the reverse effect. Well, the body knows that if it starves your tissues, your skin in this instance, for blood for more than about 20 minutes, that tissue is going to start to die. It needs blood to survive. So after about 20 minutes, it'll go, oh, you know what? We're going to have to shove more blood back into that area because otherwise it's not going to survive. And that's when we get things like frostbite, right? In extreme cold conditions. The same thing is true of where you're icing whatever injury you've got going on. After about 20 minutes, the body's going to go, yikes, we've lost blood for too long to this area, and it's actually going to do the reverse, and it's going to throw more blood into the area, and then you can actually get more pain and more swelling. So 20 minutes max, 10 minutes on a bony area, remove the ice. Then you need to wait until that area has come back up to body temperature. You know, after you've moved ice, the thing is still pretty cold. Wait until it's back up to full body temperature again before reapplying. And that's only really within that initial sort of 24, 48, if it's a really, nasty injury, hour window that you want to be using that procedure. You want to combine that with compression, so compressing the injury area, and elevation. Go and watch the ankle sprain video and I'll talk about it in the context of an ankle sprain. Can't always elevate areas of the body depending on which area has been injured, but ideally the injured area needs to be higher than your heart. Your heart is trying to drain and pump blood in and drain fluids out of an area. If it's lower than your heart, it has to do it against gravity. It can make your body work harder. So elevating the area can be useful. If you've sprained a wrist, for instance, from arm bearing, weight bearing work, then I always say when you're in the evening sitting and watching TV or whatever you're doing, put your hand up on your head to help it drain off. If that injury is not resolving quickly, if the ice procedure is not dealing with the issue, again, always seek medical advice. When you watch all the injury videos on specific injuries, I'll kind of give you the warning signs for that particular area of when you need to get some help or what you can just handle yourself. Okay, chronic injury. That word refers to anything really after that sort of 48-hour initial couple of days of, it's really loud and horrible injury. When it starts to go out of that acute phase, we're into what we call the chronic phase. Now, icing, as we've seen, it's reducing inflammation, but we've seen that inflammation is actually useful. It's healing. If you're constantly icing something, you're actually slowing down that repair work. We need to be mindful that we use ice judiciously, and a lot of people will say don't use it at all in the chronic phase. If, however, you've got an injury that's kind of doing okay, it's not too angry, it's a little bit grumbly, but then you go and do a class or a performance or something and you flare it up again, you can actually dip it back into that acute phase. So if you're getting like acute inflammation and swelling again, then you can kind of treat it like another acute injury. But typically in this chronic phase, we can use what we call contrast bathing, so warmth and cold. When we look at muscle injuries, muscles typically prefer warm rather than cold once they're in this chronic phase. We actually want to bring blood to the area, not starve it out of the area. Contrast bathing between hot and cold can help get a nice flush of blood coming through, and it can help drain out waste product materials from that healing process. But often in that chronic phase, if it's getting a little hot and angry, I'll often say just use like a cold cloth or something. Just run a cloth under cold water and apply that rather than ice, which can be quite aggressive. And typically in that chronic phase, soft tissues tend to respond better to warmth rather than ice. So it's something you have to play with. I'll often say, well, try something. If it helped, then do that. If it didn't help, then maybe try something else. But icing repetitively is not really what we want to be doing other than in that acute phase. Other things to do to avoid the inflammation: inflammatory foods. Things like processed sugars, gluten, sodas like fizzy drinks, fried foods can be very inflammatory to the body. So if you've got inflammation going on with an injury and you're eating these types of foods, then you're just adding to the volume of that inflammation. We really want to avoid inflammatory foods all the time, but particularly when we've got an inflammatory process going on. I'll do whole videos on different nutritional choices, and I'll be bringing in nutrition specialists to talk about these things. Even foods that we think are very healthy for us can be inflammatory in this inflammatory stage. Nature's pretty color-coded. Red things, we've got pictures here, red tomatoes, red peppers, think of chilies, right? Reds can be inflammatory. Sometimes we want that in our diet to get a bit of pep going, but if you've got an inflamed injury, it might be better to avoid those more inflammatory coloured foods and go more for the dark greens. So dark greens typically in nature indicate anti-inflammatory foods, less acidic foods. So acidic foods tend to bring us into that more inflammatory state. So things like broccoli, berries are quite good. Blueberries are great anti-inflammatory foods. Avocado, turmeric is good. Ginger and lemon. Lemon often people think is very acidic because it's bitter. It's actually acidic when it's a lemon. When we ingest it into our system, the way we metabolize it actually makes it quite alkaline, quite anti-inflammatory. So lemon juice can be actually useful. But again, check out the nutrition videos for more detail on that. Did you know that your emotional state can affect your level of inflammation? Remember I said back at the beginning that inflammation is part of our defense system, part of our system of boundaries. It's defending the boundaries of our skin, for instance. It's also defending our emotional boundaries. If you watch the videos on anxiety and stress, you'll see that the body doesn't really differentiate between a physical threat, a cut, an attack, or an emotional threat, us attacking ourselves. Dancers are not always the kindest to themselves. We have a lot of internal talk that's often quite like an attack on ourselves. If you are attacking yourself, guess what your body's going to do? It's going to defend itself. Guess what it's going to use to do that? Inflammation. This is something I see so often with dancers when they say, why does my injury hurt more when I'm stressed? Why is it that I thought I dealt with that back injury, whatever it might have been, I was all good, and then I suddenly, a few weeks later, it was back. And often people will say to me, there was no reason at all. It came out of nowhere. I didn't do anything. I didn't fall. I didn't overstretch it. I've been doing all my exercises and taking care of it. And it suddenly came back. One of the questions I'm going to ask is, were you particularly stressed at that time? Did you have anything else going on? Oh, well, actually, yeah, I had this whole audition thing and I was kind of freaked out about it. That's why. Inflammation is a stress response. It's part of our stress response. If your body thinks it's about to be attacked, either by an external predator or by your own mind monkeys, I'll talk a lot in the emotional health videos about your own mind monkeys. If you are chattering to yourself, not good enough, I didn't do well enough in class today, or I'm never going to get hired for that job, your body thinks it's under attack. If you're under attack, you might, if it was a bear attack or something, you might get an open wound as a result of that attack. So the body's going to produce inflammation just in case. Okay, let's be ready for any eventuality here. If it's an emotional stress, you're still going to produce inflammation just in case. But of course, you're not then using it because there is no wound or injury to fix. Therefore, that inflammation is going to run unchecked through the bloodstream. Remember, it's running through the bloodstream so it can go to wherever it's needed. If there's nowhere for it to go, it's actually going to travel round all your old injury areas and light them up. It's like the volume dial goes up on all those areas of your body. You've got stuff going on in your body all the time. Even if you've done a class and you're not feeling particularly sore afterwards, there may have been some elements of tissue damage that occurred that are not at your level of perception. Go and watch the pain video to find out more about this. But when you are in a stressed state, it's like the volume dial goes up on your inflammation and also your perception of pain. So suddenly everything's louder in your body and you think I've got a million things wrong with me, and that makes you more stressed, and then it goes on and on and on, right? You're on that runaway train again. Your current and past stresses can affect pain and inflammation levels. And this is a quote from a study by the American Academy of Pediatrics that says, early experiences are built into our bodies. Significant adversity can produce physiologic disruptions or biological memories that undermine the development of the body's stress response system. So if you are stressed in your dance classes as a child, maybe you've got a teacher that kind of stresses you out, you can be producing inflammation and your body kind of learns to do that. And now every time you go into a class, you've got that biological memory. A dance studio means stress, and the body goes, oh, we get attacked in there. Remember, it may just be a verbal attack or an emotional attack. Therefore, we better produce inflammation in that environment, right? It's a safety mechanism. Logically, it doesn't make any sense, but the body's not operating on that level. Again, watch the stress videos to find out more about this. But this is why we really need to take care of our emotional health, our internal narrative. You may not need an aggressive teacher to make you stressed out. You can just do it to yourself. Not good enough. I didn't do that turn properly. I'm not very good, right? Being mindful of that is being mindful of your inflammatory levels. As I say, watch the stress videos and I'll give you strategies on how to manage all of this. Other things that can cause stress. There's another study that was done looking at social stress and targeted rejection. This was not a study done in dancers or performing artists. It was done in general population of adolescents, and looking at what happens when they undergo social stress and targeted rejection. For me, this is just social media, right? Likes, comments, all these things where we're getting that social stress. And obviously, as dancers, we're always comparing ourselves to each other. It can be a socially stressful situation. Targeted rejection, the auditions, the competitions, next, no, next, no, next. That's targeted rejection. Even though it's just a part of the world of dance in some instances, we need to be mindful of what that's doing at a biological level to us. This study looked at teenagers who've been exposed to this sort of thing and followed them through into later life. And what it showed was there was a 20-fold increase in the risk of depression. It leads to increased inflammation, right? All the things we've just been talking about. And it activates areas of the brain that are involved in the experience of pain. Check out the pain video to learn that pain is not just about something's damaged, you get pain. It can actually be just a response in the brain that doesn't even need a physical thing to trigger it. And what they concluded with this study is that the health risks for social stress and targeted rejection, the health risks are higher than for smoking, alcohol abuse, and physical inactivity, people that lie on a couch all day. Where's the poster campaign for that? Where are the warning labels for that? Now, hopefully we can help to change our industry so that we're not under this level of stress and rejection all the time, but we live in the real world too. We can have tools that can help us to manage that stress and rejection so that it doesn't affect our biology. I always say, nobody runs my biology but me. But I need to know how to do that well so that I can keep all those things that are coming in at me, whether they be physical or emotional attacks or my own mind monkeys, how I don't let that affect my inflammation levels in my body. Watch all the videos on stress and emotional health for the tools of how to do that. Summing it all up, inflammation is information. Don't ignore it. Listen to it. It's your friend. It's going to tell you things that you never thought you knew about your body. We need to be mindful of your self-care, both physical and emotional. They're not separate. These are the same things, the same biological experiences happen from physical injury and emotional stress. Don't let your injuries become chronic. In the pain series of videos, I'll be talking about chronic pain, where you're just getting these grumbling injuries that go on, even when you think you've actually, rehabbed that area well. The inflammation keeps happening. Consider your nutritional choices. What are the other things you're doing to fan the flames of that inflammation? And don't do them. Make better choices. Consider your emotional state around your injury. If some area of your body is feeling particularly sore today, it may be the emotional state that's driving it rather than a physical thing. Listen to your body. And if you're in any doubt about anything that's going on, go and get healthcare advice. It's much better to find out that it's really nothing at all and it's just your own stress and you need to handle that than just ignore an injury that can then become recurrent or chronic. Okay, that was a little look at how inflammation happens in the body, all the different things that can trigger it, and some things that you can do to help manage it. Take care of your emotional health. Listen to the little whispers in the body so they don't have to become yells. Hey!